So, a 40-year-old male is brought in due to spasms of his extremities. On exam, it is noted that there is severe hyperextension of his back and has neck stiffness, and his wife mentions that recently the man stepped on a rusty nail in the garage. What is the mechanism of the toxin causing this? So, the first one, ADP ribose being added to EF2, B, inhibition of GABA glycine release at spinal synapses, C, impairment of acetylcholine release, and D, widespread hemolysis due to membrane damage. So I'll let you answer it and then I'll explain it. Okay, so the answer is going to be B. So if we just go down here. So the thing about this question is it's essentially a two-step question, right? So one is that you have to figure out the diagnosis. So you have to figure out what is causing this. Second is is not only what's causing it, but what's the mechanism of action of that bacteria. So what's causing this is Clostridium tetani. So this is tetanus. So everything that was in the question stem was essentially the symptoms of Clostridium tetani, which the disease process is called tetanus. And so how the mechanism works is inhibitory neurotransmitters such as GABA and glycine being inhibited. So they're not allowed to go to the allowed to go to the postsynapse. And so what does that do? So normally, since these are inhibitory neurotransmitters, what they normally do is that they relax. So GABA and glycine both cause relaxation of the muscles. So what happens if you inhibit that, right? So if the normal is relaxation, then if you don't have that, the default option is going to be contraction. So that's what ends up happening with these types of patients. You end up having contraction of a lot of their muscles. So just a few of them is trismus, so otherwise known as lockjaw. So you have jaw muscle spasm. You can also have another thing called rhesus sardonicus. So essentially, this is where you have muscles of the jaw contract so hard that the patient is forced into this weird type of smile. And so that's why it has this part, which is like a sardonic smile. And you can Google pictures of it. And so the third part is opisthotonus. So essentially, this one is where you have extreme back muscle contractions, and that's why in the question stem it shows it. It has that in the question stem. So essentially, they have severe extension of the hyperextension of the back, and that's what that is. The other thing is the extremities. You can also have that as a problem. But it's interesting because the first sentence, if you just took that, only that sentence, you would think about seizures. But then the next one is when you start thinking about tetanus. And then if you just saw the neck stiffness, you'd start thinking about meningitis. So I think as you progress through different questions and different body systems, as you study them, you'll quickly start coming up with a differential as you start looking at these problems. And so we went over those three things. And so essentially, when you see a patient with a lot of muscle contracture, obviously you can think about seizures, but in this context, if we're thinking about a bacteria that can do something similar, we'd start thinking about Clostridium tetani. And so how does that work? So Clostridium tetani has one form, which is the bacteria, but the other form is the spores. So these spores remain dormant in soil, which is where it's typically found. And why it's always associated with rusty nails, which is the other part of this question stem, is the fact that rusty nails can have these spores in the little edges of them. And the second part is wherever you have rusty nails, it's usually like in the soil, or it's in a place where it's very hospitable to these bacteria and to these spores. And so the final thing is, since it's a nail, when someone steps on it, not only do you have the spores, which by themselves can't really do anything because your skin acts as a barrier, but once you have the nail part, you now have something that can puncture through your skin and essentially deliver that spore into your body and into a place that's hospitable for the bacteria to start growing, and the spore can become the bacteria. And so then it can produce the toxin, which can end up causing all these symptoms. And so the easiest way to prevent all of this is obviously getting the tetanus vaccine. And so most people are vaccinated from tetanus, so this isn't really a problem anymore. However, if this does occur, we can always give them tetanus immunoglobulin if they're not vaccinated. And so this can help bind up the toxin that's being produced. And you can actually also give metronidazole IV to help kill any bacteria that's there. And so that's essentially the answer to this question. But then just going over the other answer choices, we have Clostridium diphtheria. And so for this one, we have ADP ribose being added to EF2, which is elongation factor 2. So essentially what this bacteria does is release a toxin that inhibits protein synthesis, specifically translation, which EF2 has an important role in. And so obviously this is not the mechanism of action of Clostridium tetani, which is what we discussed prior. And so this would have different symptoms, also because you would have the pseudomembranous coating of the back of the throat, and you can also have lymphadenopathy as well. And so for botulinum toxin, so this is actually the reason why we don't recommend babies less than 1 year old to have honey, because you can actually have spores in the honey that can be really critical and hurt these children, just because you're giving them spores on accident, and then it can result in flaccid paralysis. And so essentially the mechanism of action of this toxin is that it blocks acetylcholine in the neuromuscular junction. And now just a quick note about flaccid paralysis. So flaccid paralysis is different from the paralysis we see in Clostridium tetanus or tetany, because in that case it's called spastic paralysis. So essentially the difference is in flaccid paralysis, all the muscle groups are very relaxed, versus in the other one, and how it's typically described as floppy like. And so if you remember Sketchy, in that picture you have the robot essentially flopping down, and essentially that's what's describing that flaccid paralysis, where you have the muscle groups being very weak and relaxed, versus in Clostridium tetani, where you have all the muscle groups being very contracted. And so for the final part, we have Clostridium perfringens. So for this one, we have the alpha toxin, also known as lecithinase. And so this one disrupts membranes. So essentially, if you disrupt the red blood cell, if you disrupt the wall around it, you end up getting hemolysis, right? So you're essentially weakening the barrier between it and the external environment. So that's going to result in the plasma getting into the red blood cell. And you end up causing hemolysis in that way. And so for this question, like I said in the beginning, you essentially needed to know both the clinical scenario surrounding Clostridium tetani, so knowing the symptoms of tetanus itself, and then knowing the second part, which is knowing the mechanism of the toxin itself, which is going to be inhibition of the GABA and glycine release at the spinal synapses. So thank you for watching, and I hope it helped.